Mr. Chairman, I would like to congratulate you on your appointment to chair the 52nd session of the Commission on Population and Development. My delegation is reassured by the high quality of your coordinating efforts, which have already enabled us to adopt at the beginning of the session the political declaration. My delegation next would like to align itself with the statements of the State of Palestine on behalf of the G77 and China, and the Federal Republic of Nigeria on behalf of the African Group. 25 years after the International Conference on Population and Development, the ICPD, we have the opportunity to proceed to the review and assessment of the program of action issuing from this conference and to determine its contribution to the Sustainable Development Program through 2030. My country recognizes the global commitment to sustainable development that is inclusive, safe, and resilient. The achievement of sustainable development in an integrated and coordinated way at all levels, with the participation of all those concerned, is essential to leave no one behind. As we are aware of the remarkable progress that has been achieved in the areas of health, education, and women's rights, we must redouble our efforts in order to honor in the very near future the promises of the ICPD for those who have not yet benefited from them. While we commemorate the anniversary of the meeting in Cairo in 1994, it is appropriate to note that our action programs at the national level should be moving towards the pursuit of implementation of the ICPD program of action at the global level. For its part, the government of Benin, in order to strengthen human capital, has, since 2016, been pursuing in the health and education sectors social measures, including the waiving of enrollment fees for girls in the first cycle of general secondary education, as well as those enrolled in industrial courses in vocational schools. The government has also been covering cesarean operations, as well as treatment for malaria in children under 5 and dialysis. Efforts have also been made for the empowerment of women, gender equality, and the improvement of maternal and neonatal health, the improvement of sexual and reproductive health, and the reduction of child mortality. These measures are at the very heart of most of the goals whose mission is to establish sustainable communities. The 2018 report of the Secretary General on the SDGs noted that the maternal mortality rate in sub-Saharan Africa dropped by 35%, and the under 5 mortality rate, for its part, dropped by 50%. Moreover, the assessment of the 8th Cooperation Program 2014-2018 between Benin and the UNFPA concluded that it contributed, among other things, the following key results. A network composed of 125 health establishments offering emergency obstetrical and neonatal services and tracking of maternal deaths was set up for women's sexual and reproductive health. Second, the expansion of the cyanopress contraception option and training for 1,129 community volunteers in order to distribute contraceptives in communities, and particularly in rural communities. Third, the treatment of obstetric fistula in more than 500 women was carried out. 4, capacity building for advocacy and provision of services by a panel of young people enabled 13 networks and associations to be set up. And finally, women benefited from standard procedures to combat violence against women. These advances put in perspective the 9th Cooperation Program, which is beginning this year and goes through 2023. It has the purpose of building on this progress and also advancing the National Development Plan for the period 2018-2025. To conclude, Mr. Chairman, my delegation fervently hopes that the upcoming high-level conference in Nairobi will enable us to move forward the program of action and to further assist even more than today in forming a broader coalition of stakeholders in order to better preserve the progress achieved. Thank you.